Hi, I'm Allison Pawley, and welcome to Bellarmine University. These students behind me here are involved in Bellarmine's second-degree nursing program. If you're someone who has no background in nursing, but you'd really like to break into that field, well, you've come to the right place. So come on, follow me, and I'll show you what it's all about. Bellarmine's accelerated nursing program is attracting attention from students across the country, and here's why. One reason that people love this program is that it's only 1 year. Traditional nursing programs last several years, and even other accelerated programs across the country take 15 to 24 months to complete. This program covers all the same material while still allowing students to finish their degrees quickly.
I'm Julie Armstrong-Bennix, and I'm the Senior Graduate Admission Officer that works with all of our nursing and health sciences students here. And one of the programs that I recruit most heavily for is the Accelerated Second Degree Nursing Program.
My name's Dana McNeely. I'm an Assistant Professor of Nursing at Bellarmine. I have been faculty at Bellarmine since January 2004. I've been a nurse since 1991.
My name is Dr. Carol Smith. I'm an Assistant Professor of Nursing at the Lansing School of Nursing and Health Sciences at Bellarmine.
Main reason I chose this program is because it was 1 year and I can just get through it really quickly, and because I've been in school basically since I graduated.
Of course, this fast pace can make it challenging.
It's really intense. It's very fast-paced. You're constantly learning a new way to study for every class. With 7-week sessions, it goes by really quickly, and right when you feel like you're starting to get a grip on what your teacher expects of you and where you're going and how you're being tested, it's going to change.
Another reason that students choose this program is that people can enroll with all kinds of backgrounds. Students come to Bellarmine from all majors and diverse first careers. Michael Luckett is one such student coming here with a degree in philosophy.
It's been a huge adjustment, that's for sure, but the pre-req classes help you get ready for that. And in the beginning, we're all fumbling through things, we're all unsure about ourselves, but we've learned to study hard, and the knowledge will come in time.
Michelle is another student who has a diverse background, having worked in the food and beverage industry for about 5 years before returning to school.
It's hard to get used to being a poor college kid again, but it's neat because I think everybody that's in the accelerated program has gotten their degree and they've been in the real world, and so I think there's a focus of knowing what you want and what you want to get out of it, and that being enough to push you through the program.
But the diversity doesn't stop there. Students come from all over the nation and even from other countries. Students range from ages 21 to 65, with the average being about 32 years old. About half of them are married or in committed relationships, and many have children. Although students in this program are predominantly female, male students represent a growing population of about 10 to 15%.
At first it's intimidating, but I was pleasantly surprised. I think in my first class there were about 8 guys in my first class, which I was very impressed by that ratio.
And this diversity of all kinds is paying off for the students.
The students learn from each other, and they can bring their insights from their past life experience into the classroom and into the clinical settings. Our accelerated graduates are very attractive employees. Most of our local facilities regard them in high esteem because they have such a diverse background before they came into nursing.
Bellarmine's accelerated program also offers substantial clinical experiences in the many hospitals located in Louisville.
Especially the clinical is my favorite part of the program. I'm really learning a lot, just experiencing being in a hospital and talking to patients and educating them and treating them. It's actually really cool.
Perfect. Skill-building nursing courses require between 45 and 90 clinical hours for a total of 765 clinical hours across the program. With access to outstanding hospitals like Norton, Jewish, Baptist, and others in the area, the students gain clinical experience in all the major subspecialty areas.
We strive for our students to have experiences in completely different hospitals, completely different patient populations, but also out in the community as well and in non-acute care settings. So again, when a student comes through our nursing program, they're going to have clinical experiences in a wide variety of settings, and that helps prepare you for when you practice as a nurse.
I thought it was going to be a lot of observation and learning by proxy, and you're elbow deep your first week. We saw patients everywhere from heart failure to gunshot wounds to caring for AIDS patients and cancer patients.
This is Mr. Henry Winston.
Bellarmine is also home to some of the latest technologies built for simulation labs. They have several medium fidelity simulators on which students practice and hone their skills. Students can take blood pressure, take a pulse in one extremity, listen to bowel and breathing sounds, and inject fluids. The full body simulators come with a variety of wounds and interchangeable parts. They also have 2 high fidelity simulators. This is Mr. Johnson. Mr. Johnson breathes, blinks, and talks. With speakers and microphones in his head, professors are able to interact with students by talking for the patient, creating a very lifelike situation. He also comes with monitors that display his heart and breathing rate just like a real hospital monitor.
I'm going to listen to your lung sounds now.
Should I try to take a deep breath?
You can just breathe normally.
Simulation labs are also equipped with cameras so that instructors can observe students and later go over the simulation to point out areas for improvement. The benefits of this program are clear if you ask Julie, Senior Graduate Admissions Officer, whose own husband actually graduated from the program in 2004.
We are consistently above national and state average in our NCLEX pass rates, and while the State Board of Nursing does not divide our BSN graduates between our traditional graduates and our accelerated graduates, we do. And what we see is the trend that our Excel graduates tend to do better on the NCLEX than our traditional students do. One of the reasons we think that is because of the condensed pace of the program.
A vast majority of our graduates actually have gone on to critical care, which has led to acute care nurse practitioner, master's and doctoral programs following ours, and multiple students going into nurse anesthetist program, which is a big draw.
Many graduates end up becoming acute care nurse practitioners, nurse anesthetists, and administrators. They go on to work in surgery, emergency rooms, pediatrics, women's health, and more. Aside from the professional aspect, there exists a great sense of community within this program. The majority of classrooms for the accelerated students are in one building, which becomes a home away from home for most students. They have computer labs and lounge rooms complete with refrigerators and microwaves. And of course, the students have to make time to have a little fun.
It's awesome.
I have a fair amount of fun, not gonna lie.
It really is. I moved here from out of town, so I didn't have any friends and I didn't know anyone. And the people that I've met in this program, it's just so incredible.
So it's a program that we're very proud of.
I'm actually really enjoying the experience. I'm learning a lot. It's very rewarding, actually.
So now you have a better understanding of what we're all about and what we have to offer. We're very excited about this program and hope you are as well. If you have any questions, please don't hesitate to contact us. Thanks for checking us out, and we hope to see you on campus someday.